Well, I think that we're going to continue to fight this health care reform bill because there's so many problems with it. We want to repeal it and then start over, replace it with something that actually addresses the costs, the rising costs of health care, because that's the #1 problem. Unfortunately, this bill is a massive government expansion, $500 billion in Medicare cuts, $500 billion in new taxes, and it leads to the hiring of 16,000 new IRS agents who are going to be coming after people if they don't pay this individual, if they don't buy insurance, this individual mandate. And that's just not something Nevadans have had a good experience with, is the IRS. I don't believe that people should give up on doing away with this health care reform bill. It is the law of the land now, but that doesn't mean we shouldn't continue to try to, destroy the bad parts of the bill, which most of the bill is very bad. There's a few good parts, but the vast majority of this bill needs to be repealed and replaced with something that's good that actually can address the cost of health care. Medical liability reform, we all agree on tort reform, except for the trial lawyers and other special interests. We need to be able to buy insurance across state lines. We need to stress more of personal responsibility and putting the doctor and the patient at the center of the healthcare world instead of insurance companies, or what this bill does, instead of government bureaucrats. This bill, I believe, is going to lead to more layoffs because there's mandates on small businesses. There's going to be a lot of games played. It's going to discourage people because over 35 employees now, you're going to be required to buy health insurance. And if a company's barely surviving, they may, let's say there were 34 employees. Now, if they go to 35 employees, they have to buy health insurance. They may not do that. So it may discourage hiring. It may discourage actually some people to get under that 35 cap. So they actually may terminate employees just to make sure that they don't have to go to that expense. And not only that, a lot of companies with health insurance today, it's cheaper for a lot of those companies to get rid of their health insurance and put people into the government exchanges. A lot of their folks will get a subsidy at that point. It's cheaper for the businesses, so we'll have more and more burden on the taxpayer because of the disincentives on business to do the things that are right because of the way that this legislation was drawn up. I think for people who are opposed to this bill, don't give up. Obviously there's an election in November. Continue to write in, continue to stay active, continue to find out what's wrong in this bill, because it's not only 2,700 pages. There's 1,700 times where the secretary, the federal government, will write regulations to determine health care policy. So we don't even know the full impacts of this bill and won't know them for a few years. So as we learn more and more about this bill, people need to stay engaged, learn about it, and then let the representatives know. And if they're going to continue to thwart the will of people in Nevada and people across the country, as the president said, elections have consequences, and that's what elections are for.